This is Maurice M. Glazer, Glazer Financial Network. I have some very exciting news. For those people who know me, know that I have been very active in the medical field since 1966. I have many doctors, almost 300, as clients of mine, and have been, of course, working offshore and with foreign clients that have foreign investments for at least 40 years. But more recently, of course, with the IRS situation going on where they're trying to locate foreign assets, we have, of course, been much busier. We have clients all over the world, and it's pretty exciting from the standpoint that people are coming forward, and we are making sure that they stay compliant and get compliant. But in addition to that, over the last 5 years, I have a vision of medical tourism. People are willing to travel for medical treatments, and they're looking at wellness, they're looking at preventive medicine, and they're looking at age management. The conceptually, from the doctor's standpoint, we look at the point that the doctors want to either live offshore or vacation offshore, and yet they want to keep their hand in medical practice. Well, this is for sure available, and with new groups all over, these clinics will be springing up. If you are a physician who's interested in medical tourism, I am working with groups that are thinking about Belize, Costa Rica, Mexico, and Hong Kong, Singapore, Macau. So if you're interested in discussing medical tourism as it relates to you as a physician, please let me know. If you're an individual, the one thing that has happened is the cost of doing medical care offshore and dental care is is much better as far as cost goes offshore. These new clinics that are going to be springing up are going to have U.S.-based physicians, U.S.-based equipment, U.S.-based thought process. Will probably be in luxurious hotels around the world, and will be a boom to going offshore, getting medical procedures done, and having a very luxurious place to recover. There's all kinds of cardiovascular, orthopedic surgery, all kinds of rejuvenation type procedures that will, be available. Dental implants, dental crowns, fertility. The industry is huge, and for people who like to travel, this will give them an opportunity to go offshore, to get their procedures completed, and to be able to, at the same time, relax in a good area of the world. Medical procedure in the U.S., of course, as everybody knows, with Obamacare, things are going to get tighter in regards to getting certain procedures completed. I think that in Mexico, there's President Calderon has actually had a message going out that medical people should come to Mexico to have medical procedures, dental procedures, because the cost is going to be less, and I agree with that. Baby boomers are going to be able to do their elective surgery offshore at a much reduced cost. Some insurance is going to end up not paying for procedures, and of course Medicare, as we all know, is becoming hit hard for the amount of cost situated in these procedures. For sure will not be available under Social Security Medicare. destinations could be many. As I said, Belize, Mexico, and Asia. If you need any information on this medical tourism, either as a profession or as a possibility for you thinking about where you're going to go, I also have a group that's going to be practicing in Nicaragua. So there are many, many alternatives and many, many thoughts that you can use in regards to your medical care. I always thought that the ideal medical care would be going on in the U.S., so you would want to move somewhere where you could be able to get back to the United States for your treatment. I think in the future what's going to happen is people are going to go offshore to get this medical care as more and more physicians from the U.S. Move offshore and work with physicians in these foreign countries and develop better techniques and better structures for handling medical care. I was actually with a client who's living in Malaysia who feels that the Malaysian medical system has improved drastically and that she herself has had medical care there and was very, very pleased. Anyway, if you have any desire to learn more about medical care in foreign countries, medical tourism, practicing offshore, please contact me at mglazer, Glazer, at glazerfinancial.com or call me at 800-999-8931 or 469-358-2818. I will be following up with more detailed thoughts on this, and I think that people who are thinking of moving offshore need to find out about it, and doctors for sure need to be thinking about it as regards to an ideal way to both retire maybe offshore and to continue to practice in one of these many clinics that are going to spring up around the world. With that, hope you all have a good day and look forward to talking to you.